Want to make your face look younger? We're going to go through everything from sunscreen all the way to facelifts and everything in between. Options for you to make your face look younger. Welcome to Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
And today we have a guest, Dr. Roger Shore, plastic surgeon.
Thank you.
To talk to us about the landscape, because it's complicated out there and there are zillions of different options. So we're just going to mention them all. Obviously, what's right for you is going to depend on a host of factors that cannot be determined by this video, but food for thought with your healthcare practitioner, with your esthetician, with your plastic surgeon, with your friend, pharmacist, whoever.
Sure.
Okay, so let's start at the beginning, Roger. Why do our faces age? Like, why do our faces look older when we're 80 than when we're 10?
Yeah, I mean, lots of things happen. I mean, we have aging changes, we have solar changes.
Yep.
The skin loses elasticity and hydration. We get pigmented spots and broken blood vessels.
You lose fat volume. We've talked about that.
Volume. You lose bone volume in the face. Everything that holds everything up, all the support structures get weaker and it falls down. So, lots of changes happening in the face over time.
Thanks a lot, gravity.
Yeah.
Thank
Yeah,
you very
thank you,
much.
gravity.
And so a certain proportion of this is inevitable, right?
Yep.
So we're not Benjamin Button. We can't roll it back. But there are some things we can do, just like bone density. We had a bone density video we talked about. Listen, we can't necessarily grow it back, but we can try to slow it down.
Sure.
So
Slow down that facial aging. Let's go through from like the least invasive stuff to the more invasive stuff. Can we organize it in that fashion?
So if people come in and they say, like, what are my options? Like, I think sunscreen is critically important. If you're not protecting your face and skin from the sun, well, then you're aging it at a much faster rate.
and this should start very young, right?
Oh, absolutely. Like, burns at no age are really safe. They get away with it, but it's all causing damage.
So sunscreen we talked about before to reduce the risk of cancer. That's probably the main reason you use
absolutely.
sunscreen. But bonus points, you get to look younger if you use sunscreen. That's an important one.
Yeah.
Would you say, if you had the means, that it would be reasonable to have some type of a face cream that you put on every day that has an SPF built in, regardless of the winter or how much you're outside? You probably should just make it part of your routine.
Yeah, I think that is something that would be recommended by every esthetician anywhere in the world.
Okay, so sunscreen.
Do you do that?
No, I do not do that. I should do it. Do you do that?
No, but I should now.
Yeah.
I'm gonna. Can we cut? I gotta run out of some cream on my face.
We're probably not going to start, but we should, and probably our wives do.
I might.
You won't. You will not. Okay, so now you know, if one take-home point, wear more sunscreen. That's the first thing. And we've talked about this before. That means reapply. That means when you're in the water. That means when you're sweating. Think about it, and it's not one and done. If you're out there for a long time, multiple applications.
Yeah, and I think, kind of up from there, it would be like a skin routine. Cleansing, moisturizing. Retinols can help decrease fine lines. It can help turn over skin more quickly, so you have a nicer complexion. There's lots of serums available to people, and probably not all of them are going to provide the same level of benefit as each other. But I'd say the sunscreen's the most straightforward. Moisturizing, perhaps retinol would be the next with good evidence to consider.
I like the way you put that, a skin routine, right?
Yeah.
I mean, basically you brush your teeth, you brush your face.
And I think you get to decide kind of how much time and money you want to invest in this and how important it is to you. Because obviously some people are just like, maybe just like soap and water, and then other people it's a much more detailed plan before bed.
Yeah.
Taking your makeup probably is a minimum. Like if you're a woman who wears makeup or a man who wears makeup, take your makeup off. Yeah. Your skin needs to breathe just like all the rest of your tissues. Okay, so we got sunscreen. We got like a facial routine. Okay.
I think next from there come things that are a bit more invasive. Botox, Dysport, like neuromodulators that prevent wrinkling is really important. I think that it works awesome in the the area between the brows. People talk about having an angry look. I think it works great for that. Works well for the crow's feet.
Yeah.
And then fillers. So we talked early on about loss of volume.
Right.
Filler is used, and often I'll hear, I don't want filler because it can look strange. But I think that we all recognize when somebody looks strange, but somebody who has tasteful, subtle work, you don't see. They're just plumped up a little bit.
So yeah, we did level up a little on the invasiveness now. We're talking about injecting stuff.
Yeah.
And the Botox and the fillers. Can you tell us what filler options you have for fillers?
The most common would be hyaluronic acid. And that'd be the one that I personally would use. The thing I like about it is like we have hyaluronic acid already in the tissue.
Yep.
if it's done and you're not satisfied, you can easily get rid of it.
Right.
So it's not a concern there. There's less reactivity to it.
So when you say easily get rid of it, like could you go in and like physically aspirate it?
You can inject hyaluronidase, which is a
the
medicine
enzyme.
which just breaks it down.
Oh, interesting. Okay. So
Which
you're like,
some of
whoa,
them
I'm too plumped up. I'm scared. I don't like that. I'm really disappointed.
It disappears.
Interesting. Okay, I don't think I knew that.
Some of our viewers might notice hyaluronic acid is something we've also talked about in knee arthritis videos, or actually other joints as well. We do also inject hyaluronic acid, a lot of it, in arthritic joints, right? Hyaluronic acid, like you said, it's a naturally occurring molecule in the human body, and you see it in the synovial fluid and in other tissues. So you're right, it is the same stuff that we inject in knees for arthritis that we also use as
But what I would say is that when we inject your knees, you're probably not going to notice a difference in your face. If you do, leave a comment. Actually, so far, if you do any of the stuff that we've talked about in the video so far, leave a comment, but particularly about hyaluronic acid.
Any tips too.
That's right. Okay, so we got Botox and filler. Let's go one step back before we go back to the needles. What about lifestyle modifications or things that in everybody's daily life, like whether that's food, exposure to substances, whatever, what can people do to minimize some of the aging effects?
Yeah, I think all the things that are good for health in general.
Right.
Get good sleep.
Yep.
Drink lots of water, be hydrated.
Yep.
Avoid smoking, excess alcohol use, sun protection, as mentioned earlier.
Sure.
Those probably be the key things
Yep.
to prevent aging.
I like it. Just like the pillars that we always talk about for good health, they apply to your skin and are going to keep you looking younger.
Yep.
Okay, so after the injections, where does that take us?
Yeah, probably next would be some of the energy treatments like laser,
Okay.
IPL, radio frequency. So as I mentioned, we have changes to the skin, broken blood vessels, pigment spots, something like IPL can help, fine lines, wrinkles, lasering, laser resurfacing. There's different lasers that do different, intensity, and what comes down to laser is how much time do you have to recover? So if you want to have it done on a Friday and be back to work on Monday, well, something like Halo is going to work well. If you're trying to knock 10 years off the age of your skin, you might be pink for 3 weeks. So you have to consider downtime with the laser a little bit more.
What is the laser doing? Yeah.
So the laser, there's different types, but the laser can physically remove some of the tissue. That's called ablative lasering.
Oh, okay.
There's non-ablative, which basically heats up the dermis, causes like an injury to the dermis itself, so that it reorients, tightens up. You lay down new collagen, new elastin. So it's actually making the deeper skin healthier.
Is that, are they almost like a mechanical type peel? Because there are some other things too that you can peel off, kind of some of those superficial layers to refresh them. Is it the same kind of idea or not really?
Yeah, I mean, both can work. I think peels are still around, and lots of people probably get great results with it.
Yep.
I've always found laser to be a simpler concept because I get to dial in exactly how deep I want to go.
Right.
Whereas peels, there's a bit more of an art to it.
Okay.
Knowing how deep to go, less control.
Okay.
You mentioned IPL.
Yeah, IPL is not officially a laser, but it's
What
for
does
all
it stand
intents
for?
intense pulse light.
Oh, okay.
So instead of having just one wavelength, you have a spectrum of wavelengths, but they still target a specific thing, whether it's the pigment or the hemoglobin, to try to get rid of broken blood vessels.
Okay, we talked a little bit about injecting things like Botox and filler. PRP is something that's very popular in the orthopedic world. There's a lot of discussion about its benefits in soft tissue and arthritic conditions. I've heard about PRP being used for skin where they actually can penetrate the skin with these healing kind of compounds from our blood. Is that a thing?
Yeah, it's a thing. I'd say it had its moment more 5, 6, 7 years ago.
Okay, kind of.
I feel like some of the energy treatments or some of the other options are used more. At least that would be our experience. That although it's available, it's kind of gravy on top, whereas there's probably other options which provide more benefit.
Okay.
Okay. Red light. Is that anything to, I've seen that a lot popping up in my feeds, Instagram. People using red light on their face.
Yeah, I hear about it too. I don't have any experience with that.
Okay.
So
Red light.
We should do a video on red light. Leave a comment if you want to see.
Microneedling. I've seen that one come up a lot.
Yeah, microneedling. So that's popular. Again, it's all about causing an injury to the dermis.
Right.
And then you can either inject, while you're doing the needling, some serums to help with some growth factors. We have a device, and there's actually lots of them out there, but they provide radio frequency.
Okay.
So the needle goes through, the radio frequency essentially cooks the dermis, causes it to tighten up. All these things work well. They're not magic. They take time. The result you have at like day 3 is not the result you're going to have at 3 months. Like, so it takes time for these treatments to
because it's an injury and you're waiting for it to heal. It's amazing. It's amazing. Mike Tyson doesn't look 20 years old.
True. I also assume that the older you are, the more skin damage that you've had over time, the more modified your goals have to be. Obviously, if you're working on someone that's 35 years old versus someone that's 95 years old, the goals are going to be a little bit different. But this is also something I'm assuming that's not permanent, that can be done on some specific type of protocol, depending on the benefit and how fast it wears off. But you can do it typically over and over again.
Absolutely.
Okay.
Yep.
Wow. Okay. What about, and I get to ask this a lot too for its role in arthritis and bone density, collagen supplements, taking a pill with collagen in it. Is that just BS, or is there some evidence to support collagen supplements can help me look younger?
Well, it's interesting you ask, because I also question the validity of it.
Okay.
But actually, there's been a lot of randomized controlled trials looking at it, and there's been 2 meta-analyses where they put all that data from different randomized trials together, one in 2021, one in 2023, which do show an increase in skin health. I guess the specific measures they were looking at was hydration of the skin and elasticity of the skin. So I think they're still looking at the best source. The dose is probably still a little bit up in the air. And then, as you know, with any supplements, the quality of the supplement itself is going to be really important. But there does seem to be some evidence that it can make a difference.
Okay, so there you go, collagen supplement takers. There is some good evidence to support that taking a collagen supplement does help your skin. And you know how we look at a lot of different supplements on this channel, and we really look for evidence. And it's nice to see a supplement with some evidence.
Okay, so now you've wore the sunscreen, you've taken the supplements, you've got all the health measures in place, you've done some of the injections, you're like, I still want a little bit more. Is there any role for surgical intervention for people that are looking for a younger face?
Absolutely. There's lots of surgeries that are available. And really, in a consultation with myself or a different surgeon, my first question is, what bothers you? Like, what are you hoping to have changed? I don't think it's our job to look and say, oh, we'll do all of it. I ask people, like, what bothers them? And it gives them options. You know, the most common ones would be eyelids, top and bottom, or necks. People come in and they just grab their neck and they say, this is my bottom.
And then eyelids, you mean like underneath, like the big poofy bags kind of thing?
Poofy bags, and heaviness here. You know, the brows were probably a more common surgery years ago, but Botox has probably gotten rid of a significant number of brow cases.
And you've been doing this for a few years now. Not to say that you're older, but do you see like changes like in fashion? Does fashion affect sort of what people want their face to look like with time? Like compared to like 15 years ago, is someone coming in with the same sort of stuff, or is there a bit of a trend?
I think overall, healthy, beautiful skin is something that's always been desired. I think a natural looking result is still desired by lots of people. I think that the filler industry has probably changed what we accept as normal a little bit. Like I think the lips are a little fuller and the cheeks a little fuller than what maybe the style would have been 20 years ago or 25 years ago. And I think that, you know, the fact that so many celebrities are using it, it just changes expectations of what normal appearance is.
Wow, I can imagine. Because I can imagine that if there's a certain celebrity or movie star that is big, then everyone's kind of looks at features that they have and think, oh, those are kind of features I want, that kind of thing.
But I think what people want to is change. I think when we first started practice, like someone in their 50s might have been told, no, you don't get a total knee or you don't get a total hip. And now someone in their 40s is like, too bad, I want it. And if you don't do it, someone else is going to do it. So you have to have that conversation. But I think what this shares with you guys is that if there's something that you don't like about your appearance, and we all have insecurities, so go talk to a professional about it. That's the first thing. Talk to someone who is certified, you know, well-trained, has good reviews, someone that you know that is legit. That's the first thing. Talk to them about your issues, and then hear all of the potential options, and then that's for your time, for your money, for your risk tolerance, and for your goals. And if someone says, listen, we're not going to do filler on you because it's not right for you, don't think it's because they don't want, I mean, because they're still in a business, they want to do something for you, but they want to do what's right for you because you're going to be a walking endorsement for their skills.
Do you see younger and younger people coming in? Is that a thing? Like younger?
Probably for energy treatments. I think people look at like things like Potenza and laser as a way of like slowing down the aging process. And
Almost
I think
preventative
it
medicine
probably
kind
is helpful. It's kind of like going to your dentist and getting a proper cleaning once a year or once every 6 months on top of brushing and flossing.
Oh, and sleeping. We talked about sleeping. If
Oh.
you sleep on your back, sleep on your side, sleep on your face, does that make a difference, sort of?
Maybe. So I have lots of patients who tell me that like this is their bad side because they sleep on it.
I would say I sleep on one side, and I noticed that I have a couple specific creases that are sleep related, depending on how I slept. But I can't sleep on my back, because then I'll probably snore.
I sleep in a centrifuge. I set it at 1.5 G and pulls my face back. And when I wake up,
You look
I
great.
amazing
You look great.
until gravity kicks in.
You look good.
I'm dizzy as heck when
You
I
look
wake up.
very good.
But it really works. Get a home centrifuge.
Now you know. If you like this video, please like it, subscribe to our channel, share a comment about your experience with any of these anti-aging treatments. And I think the other take-home message too is, hey, the goal doesn't have to be look 20. I think age successfully, age comfortably, age at the rate that you feel is appropriate, but no hate to the people that maybe want to look younger. we all have different goals.
Look healthy. Look
Yeah.
right for your age. Yep.
Yeah, do what makes you happy.
Bonus question, do you know what laser stands for?
No.
Light amplification by stimulated emission of radiation.
There you go.
I had to flex
There you
there.
go.
You are in charge of your own health.
We'll see you next time. Thanks for Dr. Short. Share this
Thanks,
video.
guys.
See you next time.
Thank you.